MicroRNA 488 binds with a specific sequence at the 3' UTR of the PFKFP3 gene to inhibit its translation, thereby suppressing glycolysis. However, microRNA 488 is underexpressed in prostate cancer cells, so our proposed treatment is microRNA replacement therapy, which aims to restore the expression of tumor suppressor microRNAs and thereby bring back cellular processes that are active in normal cells and interfere with oncogenic processes required for cancerous phenotypes. There are currently many microRNA replacement therapies, and some outdated and inefficient options include introducing microRNA precursors in a viral vector, but studies have shown these to have limited infectivity and generally would require a relatively large DNA vector. Additionally, tumor cells appear to interfere with the maturation of microRNA precursors. Intratumoral injections are another option, but they are only limited to tumors that have yet to metastasize and those that are easily accessible. We are proposing a new and emerging technique, microRNA mimics delivered via neutral lipid emulsion-based nanoparticles to be administered through systemic injection into the patient. These microRNA 488 mimics will act like the endogenous counterparts and bind to the 3' UTR region of the PFKFP3 gene to downregulate it and to stop glycolysis and thus cancer cell proliferation. Unlike viral vectors, microRNA mimics are relatively smaller and are activated once they enter the cytoplasm of their target cell. These lipid-based delivery systems have neutrally charged lipids and are thus less likely to form aggregates in bodily fluids, be filtered by the liver, stick to endothelium, or engulfed by macrophages. Previous studies have successfully used microRNA mimics to treat cancerous tumors by delivering them systemically and allowing for accumulation in tumor tissues where they suppress associated oncogenes. There is also fear for exogenous microRNA toxicity in normal tissues, but there is a lack of evidence to say this is the case. Studies with mouse models show that increases in microRNA in normal tissues as a result of systemic administration is well tolerated and will not affect normal cells. Some possible reasons may be because pathways that are regulated by microRNA mimics are already regulated by endogenous microRNAs, or that administration of microRNA mimics are an insignificant increment in normal cells, or that normal cells are able to regulate microRNA mimics whereas cancer cells are not.